Hello and welcome to Kimboshi Radio. Just Rick this time because yet again Nick has a real life, but I have a friend today. This is my friend Larry, and Larry is here because she is a super fancy surgeon type person who focuses on some things that are very prevalent in the sumo community, such as neck injuries. So what I really want to do today is talk specifically about Takakeisho with this news that now he is maybe after all going to come back at Sekiwake and try to bounce back to Ozeki, but I don't personally think that's going to happen as much as I might want it to. But to intro us, Larry, can you give me some better description than I'm able to do of why exactly you are smarter than me for many reasons, but why on this particular issue of neck injuries you know more than me?
Well, not smarter than you, but hi, I'm Larry. I'm a physician assistant. We actually went through an official name title a couple of years ago, and so we're actually physician associates, but state laws and things take a while to catch up. So I'm a PA, and I work with a neurosurgery group. So my role from day to day is I evaluate and treat patients with neck and spine pain, and the big hat or the lens that I've looked through a lot of my patients through is, would this person benefit from a surgery? And I am a first assist, and so I work with a neurosurgeon and assist him when we do a variety of neurosurgical approaches. But one of the things that we treat a lot are people that present with neck pain and arm pain. So that's where I'm
And
coming from.
that's why I am super fortunate and super glad that you were able to join us, because in addition to being a smart person, you are a sumo fan. And so I know you follow this. He's been dealing with this now for the better part of a year, but Takakeisho, the beautiful baby boy boulder, has, as best as I can tell, it's just sumo's hard to get specific news on stories, but it is a cervical spine injury, so dealing with his cervical vertebrae. But I believe the idea was that it previously had gotten so bad that it was affecting his left arm. So with an oshidashi guy, a pusher thruster, that was a huge problem. It took a lot of his power away. So for my sake, can you kind of explain what is it about, or well, let's identify what is your cervical spine, what are we talking about here, and why is that affecting his arms?
Yeah. So I'm glad that you mentioned that the articles are hard to come by. I was seeing references to things about him having a cervical disc as far back as 2001. So we're talking
Wow.
about like 3 years at this point,
Man.
maybe, that some of this has been going on. But it's really hard to tell. It's really hard to find anything about what is going on with Takakeisho. And so, I will come into this saying, I'm not his care provider. I do not know like his clinical case. So there is going to be a certain element of speculation about, what we think is going on with him. But to start with, cervical spine, you have, if you kind of think about your spine, there's 3 sections of it. So there's the cervical spine, which is your neck. You have your thoracic spine, which is sort of your mid back, and then you have your lumbar spine, which is your low back. And at each of these different levels, there's a different number of bones and there's nerves that exit at different levels. So in your cervical spine, you have 7 bones and actually 8 nerves. The cervical spine's a little bit unusual for that. And in between each of those bones is an intervertebral disc, which is sort of like a cartilaginous cushion that holds up height between each of the bones.
Yeah, so just for like layman's terms, same thing. It's cartilage. It's the same kind of stuff that you'll have in your knees, which is when it wears down and you end up with like osteoporosis or like arthritis, things like that when you get older, or when you're like me and you hit your mid-30s and your knees hurt all the time. But more important because it's your neck.
And so what's also important to remember is that that's sort of like the front of your spine. And then there's a place in the back where the bone above and below articulate. And that's another joint. That's called your facet joint. And you have a left and a right one. And again, that's a space where the two bones can develop arthritis. There are ligaments and things that can get overgrown and stuff like that there. And so, just like your knee or your hip or any other joint in your body, your spine is basically a series of joints, and you can develop arthritis and degenerative change in it like you could in any other joint.
And I think it's pretty obvious that's what we're seeing with Takakeisho, which is like a travesty because he's 27, like just turned 27. And just for like context, like, do you see that ever? The patients you see, are they ever this young, 26, 27? Or like you said, 2021, this first started happening. So he was like 23, 24?
Mm-hmm. That's a good question. So, short answer is no, not typically. Typically, I have seen some patients in their 20s who develop some of these symptoms in their low back, in their lumbar spine. But generally speaking, no, not in their neck. But one of the things that we know that is specific to sumo is the amount of mass
Yeah.
that these young guys put on quickly, and also the amount of impact and the they're the tachi, 400-pound men smashing into each other. That's going to create a lot of movement in that joint. And there isn't like, when I talk to patients, I can't tell them exactly what was the thing that caused them to develop this arthritis and this degenerative change in their neck. But what I can tell them is that if you are frequently using your neck in such a way that there's a lot of movement, extension, like extending your neck back, flexing forward repetitively over long periods of time, and if it's under a lot of stress, we can see this happen much faster in much younger people.
And it's pretty obvious where that's coming from in sumo, right? Like it's the tachi, or specifically, I mean, someone who's an oshidashi guy, someone who focuses on supari, punching forward and stuff like that, like Takakeisho. That's presumably where we're going to see those impacts of your neck flying backwards.
Yes, I think that's a huge component in what's happened and happening with Takakeisho. Um, I wouldn't say any of this. Again, this is me speculating. I doubt that this is something that has happened in one bout or anything like that. I think this is probably a lot of chronic change
Mm.
that has happened over time, and then there can be acute settings. He could have a bout where he gets dinged in the wrong way, or gets pushed in the wrong way, and that can really hurt that neck.
Like exacerbates it. Like it's always
Yeah,
there, but he can be okay.
acute
What
on chronic.
can I mean, I assume the answer is no, but can the reverse be true where it can periodically get much better much quicker? Like is there any hope that in this interim between July and September something good happens and he is able to get better, because he did not look good in July?
Um, I don't, I don't want to be like a big harbinger of bad news.
No,
But
we're all expecting it.
what I kind of tell my patients is that you can kind of think of some of these degenerative changes, and we could get more into specifics about them. You can kind of think of these degenerative changes as wear and tear on a car tire. The farther you drive the car, the more wear and tear you see on your tire. The difference is that I work with a neurosurgeon, and I don't know of any neurosurgeon that can offer you a new spine. In other
Yeah.
words, we can't undo everything that's been done. Now, can you go in and surgically shave down areas where the bone has become, you've got like these bone spurs that
Mm.
are crowding out nerves, or take away parts of the disc and things like that? Sure, you can do those things. But could I completely replace a spine? No.
And
Um,
oh yeah, go on.
and I'm not even saying Takakeisho would benefit from surgery necessarily, but uh, there's a good chance that since he's been putting up with this for several years at this point, I don't think there's going to be some miraculous recovery, if
Yeah.
that makes sense.
And like even if he had surgery, what kind of recovery timetables are we looking at?
So, to be clear, you've got this cervical spine, and you've got these discs in them, and then you've got these joints that are sort of on the back end, these facet joints with and all sorts of ligaments and things. And the sort of accepted theory at this point is that if there's way too much movement in a joint, our bodies will sort of overgrow ligament or grow extra bone there to do its best to stabilize that area, to keep it from moving so much.
Ah. And
Which
that's
sounds wonderful,
uh,
but what ends up happening is that sometimes a nerve, because we have nerves that exit at each level of our cervical spine and travel into different parts of our body, typically our arms.
mm,
Um, there's a couple of exceptions, but usually where most people are impacted, it's gonna be one of the nerves that's exiting the spinal cord and coming down into their arms. And so it could be a disc, bone complex, or overgrown bone that is essentially compressing a nerve. And that could be causing arm pain and weakness. And that's kind of my speculation and why I think Takakeisho, that I think that's what's going on. I think he has, it's the fancy word for it is a radiculopathy. I think he has a radicular symptom that's going on. And that's why he loses function in that left hand and arm.
so yeah, so
Um,
so his body is trying to heal. It's is that when it's muscle tissue, is that scar tissue, or but you mentioned bone growing back
yeah.
in as well?
That's what it's thought to be. It's thought to be almost like a way to heal this. Um, so actually, surgically, what is most commonly done for these, um, that I've seen, there are different surgeons everywhere with different practices, but the most common thing that we typically do is we do what's called a cervical fusion, where we essentially go into the spine. Most of the time, we try to come in from the front of the neck. Occasionally, we have to choose to go through the back of the neck. And you basically retract all the tissues and things aside, and you get down to that spine. You clean out that disc space. You sort of shave off extra bone or osteophytes that are in the way. And then you actually place a new, like a little bone graft. The surgeon I work for, we do an allograft, so we take it from a cadaver and you sort of place it in there, and then you actually put a little hardware, like a little plate over the front of the bones so that those two bones will ultimately fuse together.
Right. So you stop the movement entirely because that's what's putting the pressure on the nerve, which is where he's losing all that power in his arms.
Yes.
And so like just to be clear, like there's nothing physically he can do. He can't go like hit the rack harder. He's like this is internal.
Well, there are lots of people who have degenerative change in their neck and spine and don't necessarily need surgery. I see patients all of the time that have herniated discs in their neck or their low back, and we do symptomatic treatment. They can do physical therapy to sort of work on their posture and get the muscles that support their spine to work more optimally. Um, some people benefit from getting localized injections by a pain provider so that you go in
Ooh.
and you essentially put a steroid around that nerve to calm all of that inflammation down,
But that's like
as it's being
periodically you have to
affected.
keep doing it, right? Like cuz that reminds me of like Kobe Bryant back in the day near the end of his NBA career going in at halftime and getting was it cortisol shots and then playing again like and just doing that every game.
And to a certain extent, and that's something I hear from patients a lot is, "Well, isn't that just gonna mask this?" And, the answer is yes. That yes, to a certain extent, it doesn't take away the degenerative change that's there or the herniated disc or whatever. But, some people actually do heal. If it is a herniated disc, they can heal it over time. Their body can remove it, and some people find that they just need that periodic injection to get them by, and they avoid I mean, it's a fairly serious surgery. We do them regularly. They're common, but this is, it's a significant surgery.
And then
And
oh yeah, go.
and I was just gonna add that, one of the risks whenever you do these fusions is that you stabilize the joint in one area, and
Oh.
what we see is that sometimes there can be a fall off at the level above or below the fusion,
Yeah.
and meaning that the instability sort of moves somewhere else.
Yeah.
And so this is just me thinking hypothetically. If I were thinking about Takakeisho and what he has going on, if I were going to do this kind of surgery, one, I'd want to make sure I was going in and working at the correct level. And, if his neck is pretty banged up in multiple areas, that gives you pause. That makes you think, like, is the surgery really going to go in and fix every problem he has? And the other thing is you want to make sure that when you go in and do this, that you aren't that Takakeisho isn't going to run the risk of needing multiple follow-up surgeries.
And
And
like,
it's possible that there is enough damage in his neck that there may need to be a couple of approaches.
man, and even then, okay, so let's say he has surgery and he's only going to need the one, but like, how
Mhm.
someone on the street, how long would you recommend before they like go mow their lawn again?
That's a good question. So in typical people, the recovery time is usually I see them. This is me thinking in terms of just like my day to day.
Yeah.
Typically, when I see people after a cervical fusion, I will see them usually about 3 weeks after surgery.
Mm-hmm.
What we tell them when they leave the hospital is that we don't want you lifting greater than 5 pounds for the next 3 weeks.
Mm-hmm.
And we tell them that we really don't want them doing any activity at shoulder level or above.
Oh, not lifting
So,
their arms over their head.
yeah, essentially.
But Larry,
Um,
Takakeisho's pre-match ritual. It's the 2-arm flex above the head.
well, and Takakeisho is an Oshi sumo wrestler. I
Yeah.
mean, he prides himself on his sumo and sort of being this, I don't want to say one trick pony like it's a negative thing, but he has essentially one tool in the box.
Right.
And that's been one of the biggest criticisms of him is how could he become a yokozuna if that's all he does? And he just says, well, then I'm going to be the first. At
Yeah.
least that's what he said in the past. And so for him to not be able to sustain or do any sustained shoulder level or above shoulder level work for several weeks to months it's concerning.
Right. Like,
It
because the timelines for athletes are always accelerated. So like the 3-week thing, like what you're first saying, like my delusional brain is like, holy smoke. So could he get this surgery and then potentially still be fighting another tournament on, the like probably pumped full of steroid shots, like you're saying for that inflammation. But
Mhm.
I mean, that's definitely delusional, right?
uh, I don't know. I have to say, um, on paper, we say that full recovery time from this surgery is usually about 3 to 6 months.
Yeah.
Um,
Yeesh. So, I mean, that's
Typically, people go back to work and usual activities after about 2 months. People usually feel pretty much back to normal after 2 months. But, I mean, none of these wrestlers are in a typical situation. They're
no.
not in a typical surgical situation.
Right.
And like I said, I don't know the extent of damage in his neck. That's speaking to, a patient with a simple, anterior cervical fusion coming in from the front. If we had to go in from the posterior, it could be more recovery time. And if I were his, provider, I certainly would not recommend he gets back to any, shoving 300, 400-pound guys for several months, which, as we know in sumo, is
a prerequisite.
It's career suicide. It's career suicide. I mean, these guys can sit out and then they get demoted fairly quickly and they don't get the recovery time other sports do. But I know you've talked about that in previous podcasts.
Right. Yeah. Just so previously we had Phil on, another sumo loving friend who is a PT, but specifically because he does a lot of rehab for people with knee surgeries, like knee replacements or ACL tears and things like that. So we were using that to talk about Wakataka Kage and Tochi no Shin. And,
Right.
yeah, Phil's big point is he's like, okay, well, the first thing is I would tell them I don't even want them here with me until they lose 100 of these pounds, and it's like, okay, well, that's non-negotiable. is
Right.
is that also a factor? I mean, with this being an upper body thing, maybe that's like, because Phil's concern at that time was the idea of like, yeah, well, your knees, these are load bearing joints. So the neck, not necessarily so.
Your neck is still, I mean, it is holding your head for one, and if you think about any movement that you do, almost invariably involves your spine.
Yeah.
There is a lot, not necessarily with neck surgery, but it's surgery in general for the spine. Weight is absolutely a concern,
Yeah.
and it it makes recovery very difficult. The surgery itself tends to be much more labor intensive. You think about the amount of dissection and retraction of those tissues that we have to do to get down to the spine. It just makes for a more difficult recovery process
Yeah.
overall. And so I imagine there would be many surgeons who would not want to touch Takakeisho's neck.
Right. Oh, wow. Not just like, yeah, wouldn't even want to fuss with this.
Yes, just given the size of his neck and yeah, and
I
what
didn't
he
even think
does
about that.
because,
Oh, I'm so
you
foolish. But yeah, it's now making sense what you're saying. Like when you're talking about removing layers of tissue, like we're talking about fat. You can't even get to
yeah,
his neck.
yeah, you do. You have to be exactly, like, you have to be able to retract. It's not just muscle and, like, skin, like, we there's fat, and so you have to get through all of that to get down to the spine, and there once upon a time, medicine has come a long way. We know now that obesity is not necessarily an indicator of poor health. Um,
Yeah, I mean,
but
like,
in the realm of surgery, it can certainly complicate your outcomes
yeah,
and your healing.
right, yeah. And so, but I mean, okay, you've brought up a million good points, so I'm trying to keep my head straight. But like, you mentioned career suicide, and it sounds like you're right. Like the surgery is the last thing. Like it's, if he opts for surgery, especially at this point now fighting at Sekiwake, like we all know what was happening. He was desperately making the most recent Yokozuna bid, if only to like save his career, because that's when he could have had surgery and sat out half a year and then started to come back. And he never got that opportunity, so he kept fighting on this, which did not make it any better. And at this point, he's probably in a position like Yokozuna at this point is never going to come, and he's in a position that surgery will just end his career, right? Like I don't see any way.
My I was sort of thinking about, again, like if I were sitting in front of him and talking with him, I would have a very difficult time. Again, I'm just a PA. I am not a surgeon. Um, But I imagine that I would have a very hard time telling him after doing this surgery that I can recommend that he goes back
Right.
to sumo at the level that he was competing at, especially with the style of sumo that he's known for.
Right. Right.
I think that if he goes forward with the surgery, I think it's sort of because wrestling is done at that point. That's
Right.
just my take. I could be completely wrong. And again, I haven't seen any of his images. I don't know his symptoms. I was
Yeah.
trying to Google it, and
Oh
they're
no, they're not going to
very
tell you nothing.
tight-lipped about any of
Yeah.
it. So,
Okay. So
yeah, I can't imagine. I operate on people who return to like desk jobs.
yeah, yeah. You
Um,
operate on people like me who are just going to go sit down. Yeah.
Right. And I see people who do a lot of factory work as well, and they
Oh
tend to have
yeah.
a longer recovery, and they do physical therapy after surgery and things like that. And they take a little bit longer to sort of get back to full strength. And so for something like this, oh my gosh, like I don't know. I would have a hard time telling a patient like him that he will be able to return to full activities after a surgery like this.
Totally. And so I'm gonna take us forward in time and then backward in time just a second with it. But so like this is a question that Nick I know was really curious about, even though he couldn't join us. This idea of
Mhm.
like what does life even look like if he gets the surgery? Like Nick and I are always very concerned about life after sumo, especially with someone like Takakeisho, who again, dude is 27. You know,
Mm, mm.
but so Nick wanted to know specifically, once an injury like this gets to the point that it's migrating to other body parts, in this case to his arms, like is there even full recovery, or is this like the kind of situation where, hey, this is awesome, he's got 75% use of his arms back?
So that depends on a few things. Generally speaking, I mean, this is a surgery that we do, and it's effective. I think I read something. It's effective like 85 to 90% of the time in resolution of symptoms. I think that if he were to get this surgery, a lot of his arm pain would improve.
Mm.
Typically, if they have like a motor weakness, um, that typically comes back pretty well. If he may typically patients may have some residual numbness and tingling
Mm-hmm.
in their arm.
Mm-hmm.
That's usually the thing that lingers. And given how long he sort of dealt with this, I imagine that there is going to be some damage to that nerve. If you think about when you have like a heavy piece of furniture and you put it on a carpet
Mm-hmm.
and you move that piece of furniture, it sort of leaves a dent in that carpet.
Yep.
That's sort of I would
Oh,
expect he's gonna kind of have that pressure that kind of stays on his nerve for a while. It
yeah.
He would get better. A lot of it would get better. But there is a chance for that residual numbness and tingling and stuff like that.
Right, and because I even think about, like, so Ishiura is the comp that I like to make with the Takakeisho stuff, which is even different because Ishiura is just like the beautiful fit fat, just like stacked, and was not necessarily carrying nearly as much weight and fought different styles of sumo. But when he had that horrible toss out of the ring, I
Mm.
mean, in retrospect, it ended his career, and he, I know, had partial paralysis in his limbs, I believe. Again, reading, my Japanese is garbage and they don't tell us very much anyway, but trying to read these
Mm.
articles, but that's what I saw, is that he was partially paralyzed, but that
Mhm.
it did come back and he did have to retire ultimately. So are we thinking a situation like that? Like what's the fear here if Takakeisho keeps fighting, or like for the sake of this guy's well-being, you know?
Yeah, so like I said, I speculate that right now, Takakeisho probably has a cervical injury wherein a nerve is being compressed as it's exiting or after it's already exited the spinal cord, which
Mhm.
is a radiculopathy.
Mhm.
There, of course, are situations where you can actually compress the spinal cord itself in the canal.
That doesn't sound
And
good.
so that it's a little bit worse. So that's called myelopathy. And that is when you can bruise or ding that cord. And so that is going to present as weakness that can actually go down into your legs. That can create like problems with your gait where you sort of, it's called spastic gait, but you sort of like can't really control your legs as you move them. There can be loss of urinary function. All sorts of things can happen with myelopathy. And um, if that isn't addressed, yeah, you can become paralyzed, and there's a risk of injuring your neck in an acute way where you take a really hard hit and you slip a disc and you cause permanent paralysis. I used to work with patients that had spinal cord injuries that were known to be like that, to be complete, and that was after typically a trauma,
Hmm.
motor vehicle
Car accident?
accident,
Okay.
gunshot
Yeah.
wound,
Oh, yeah.
diving into shallow water,
Mm.
the things that we know from Christopher Reeves
Mm.
back in the 90s.
Yeah.
And so yeah, there is a chance that he could develop that myelopathy where he actually injures the cord itself, not just a nerve. And that is a concern, and that is something that you do need to surgically address,
Yeah.
because if you don't, those symptoms can get worse.
Yeah, like, I mean, he's 15 seconds of an obby match away from being paralyzed, is what it sounds like to me.
He does have a very thick neck, which
Oh,
is
okay.
a nice help.
There you
I
go.
frankly, I think that's part of what keeps him from any of these guys really from sustaining an injury like that, is they do have so much tissue.
Interesting. Yeah, wow. Another thing that, like, that's so fascinating to me about sumo, because it's kind of one of those things I feel like that, I don't know, this is, I'm going to call it like farm wisdom, right? Like back in the day, you figure things out before you actually have science behind it. But I'm like, oh yeah, put on that weight and then you can do this.
I'm like I said, I actually know if that's really what's protecting him? No. We also know that some people just have like when they're born, they have like very narrow canals, whereas other people have like wide open ones and
Oh,
can
so there's some
take
give.
on a lot more degenerative change,
Huh.
herniated discs compared to other people. Everyone's different.
Yeah.
But yeah, I would imagine the fact that his neck is so big is a service to him
Right.
and keeping him from a very serious injury.
Gotcha. And so, speaking of that, if surgery is out of the question, and if he's serious about coming back for September, when he already did
Mhm.
not look good in July, I'm curious. This is the part where I want to take us back a little bit. Like, what can you describe for me? And I know this would be secondhand at best, maybe more like third hand, a description coming from
Mhm.
you. But like, what does this feel like for him out there fighting?
I imagine, um, I imagine that primarily what he experiences is just a lot of neck pain.
Okay, neck pain and tingling and
That's
numbness in the arm.
yes, typically they present with a lot of neck pain, and then they get shooting pains that kind of, if you've ever like hit your funny bone and you
Mm-hmm.
get like that nerve pain that shoots down. I imagine he has a lot of shooting pains like that
Mm-hmm.
that come down into his arm, associated numbness and tingling that could go into some or all of his fingers. And, I imagine that it's just very uncomfortable with a lot of movement and pushing, bending, lifting, and twisting. All of those things are going to be things that exacerbate this. So, um, it's also possible some people get a symptom where they sort of flex their neck forward, like bring their chin to their chest,
Mm-hmm.
and they get like electrical pains that sort of shoot down their spine.
Oof.
So I imagine he's in a great deal of discomfort
Yeah.
being out there, which is part of the reason I think he struggles.
Yeah, I mean,
I
we've
say
seen it.
part of the reason. I think that's pretty much all the reason he struggles.
Yeah, yeah, the massive drop off, obviously, and so that kind of. I mean, you don't need to put an opinion on this, but I'll just like. I mean, you can if you want, because I'd love to hear it. But I just like. I cannot imagine him getting Ozeki back. Like this. This seems insane to me that he's going to come back and fight this tournament at Sekiwake. Like I just how.
He just didn't look good in July, and I mean, these guys are trying all of the conservative measures under the sun. I am certain.
Hmm.
I am certain that he has done the physical therapy. I am
Yes.
certain
Yeah, they're
that he
shelling
has
out money for
gotten
it.
the injections. I am certain that he is taking medications to control nerve pain. I'm sure that they're trying everything that they can. And so, yeah, I just don't, from my granted, I'm new to this field, but from my limited clinical perspective, I just if knowing he's probably exhausted all those conservative things, I just don't know how he could make a resurgence.
Yeah, right, right. Like all those things have probably already been happening for the better part of a year, and
Mhm.
the best it could buy us was what just happened in July. I mean, we saw right like during the July Boss show. I don't know if you saw. Did you see the look on his face in that match that he lost? The Gyoji called it for him, and I believe it was an Ura match. And then
Mhm.
they had a council, and it went against him. And you just knew, you
I
knew,
saw.
because at that point he needed to go 3-1 in the last 4 days or something like that. And it just like he is absolutely laying everything on the line. It's one of the things that actually frustrates me when online some people are so anti Takakeisho and are like, well, he should never be Yokozuna. And I'm like, I just it's fine if people don't like him, and it's fine if they don't like his style of sumo or whatever it is. But the guy lays it all out there. You can't tell me from like an effort and honor standpoint that the guy doesn't fight like a Yokozuna. I don't know.
Well, and I think, to be perfectly candid, I'm not a huge fan of Takakeisho personally in his style of sumo, but I think that this more speaks to just sort of like how devastating these injuries are and to, the the lack of longevity in this
Yeah,
sport. And
yeah,
you and I have talked about this offline several times about how it just doesn't seem sustainable
yeah,
to have all of these, I think, these 6 Boschos or whatever a year, and how quickly they get demoted. I know you
yes,
talked about that on your episode with Phil.
yeah,
You were talking about in terms of Tochino Shin and just how quickly he was demoted to a non-salaried rank, and it's just it's not feasible. It's not sustainable for some of these guys, and it is heartbreaking, and you want them to do well, and he is a young guy. So
27 is nuts. Like, I can't believe all these things that now he has to. I think that's why Nick wanted me to make sure and ask that question I asked, is this idea that, like, he very much has so much life ahead of him. More than 2/3 of his life should still be ahead of him. And we're already talking about this stuff.
yeah, and um like I said, I mean, he could have his surgery and do very well, but in the terms of sumo timeline, it's it's a very long recovery.
Yeah.
So
Oh, right. Exactly. And that's where, I mean, we keep saying we want to do an episode on this, but haven't quite gotten around it. But just like Chris Sumo very recently did a video where the Yokozuna Council is saying, oh, they want to reopen the question of can we save ranks for injuries sustained on the Dohyo, like in a basho, because that was discontinued relatively recently. And admittedly, guys were abusing the system. They were kind of hiding injuries that were sustained in training and lying that they were on Dohyo or whatever. But that's almost a moot point to me. I can't believe that that's the kind of stuff the JSA are talking about, because I'm like, dude, save your sport, save your wrestlers. Like, you can't tell me, and I appreciate your candidness, or like, because I'm fine. Like, if you don't like Takakeisho, anyone can dislike anyone. It doesn't matter. Nick says all the time his favorite wrestler is Abi, and he's like, and everybody hates me for it. And I'm like, yeah, man, they do. I don't know what to tell you.
that is a spicy opinion.
that is his hottest of hot takes. Yes, but you can't tell me that sumo isn't better when guys like Takakeisho and Abi are firing on all cylinders, or for that matter, Takakeisho, who now with his back spasms is constantly pulling out, Asanoyama, whose knee I think that's over for that guy. There's no way he can do it again.
It's hard to say, right?
Yeah.
But and the other thing I would just, add just to comment, this question of, can we revisit this idea of giving people time off if they sustain an injury in the ring? Like I said, if Takakeisho's clinical picture follows what people's usually do follow, this is not something that happened in one tournament or in one match.
Oh,
this is
yeah.
probably the result of chronic degenerative change that has happened over a long period of time.
Yeah.
And, there is not going to be, and there are very rare instances where I can look at a patient and say, and even if I am pretty confident, I always say I'm not 100% sure, but it is very rare for me to say, I think that X is what caused this to happen.
Right. You talked about back. Like, if somebody wrecks their motorcycle, then you can be like, hey, I'm pretty sure we know what happened here. But yeah, everything else.
And even then, I have people who will come in and see me, and they were in a smaller motor vehicle accident, and they'll say nothing hurt until I had this accident, and they get very frustrated with me because I will point to, bony overgrowth and all of this stuff, and I'm like, this is not what happened because of your car accident.
Yeah.
This was an acute injury that happened to things that had been building up in your neck or your back for a long time.
Good point. Yeah, because you're like, dude, bones. This can't grow in 2 weeks. This is
exactly.
Yeah.
Exactly. And so, if Takakeisho is anything like some of my patients, it's going to be really hard to say, well, it was the match on this day with this wrestler that caused that.
Right.
Sometimes, I think with knee injuries and things like that, it's a little bit different.
Yeah.
But even then,
Yeah. They talk about how guys who practice a lot of throws are way more, I mean, Phil even brought this up, are way more likely to get those knee injuries because of that, like, horizontal torque.
The torquing.
Yeah, exactly.
Yep.
Yeah. And shoot, maybe it's the same thing for Takakeisho's neck, whipping it around as he's trying to, like, size guys up and things like that. But man, that's a great point. I know I'm jabbering, but I just, like, you make such a great point that you would talk to him about, like, and it'll be obvious to him, I'm sure, but like, this happened over years. You've been doing this for years. And in any other professional circumstance, like, I don't know about other countries, but in America, that would become an OSHA, like an OSHA claim, like this idea of, like, this was workplace endangerment that happened over years of you completing your responsibilities as assigned at work. Well, as a sumo wrestler, he was completing his responsibilities as assigned. And I'm not trying to be negative, but just like, hey, the JSA did this to him,
It's yeah, and you have to. I have conversations with patients all the time that I can't tell them what to do for work or but I've had hard conversations with some patients who I mean they work on factory floors or they work in welding, and I have to tell them, I'm like, look, like I'm not saying you can't return to your job, but there's a physical toll that comes with that, and it, you may not ever be at the full level that you want to be for some of those things, and that's a hard conversation. And I imagine for something like sumo wrestling, it's a very hard conversation and a very hard thing. So
Especially someone who from such a young age has dedicated himself
Mhm.
to this, and this is the only life he's known, and with the uncertainty around elder stock for the Tokugoyama stable right now, I mean, he should.
Yeah, what is up with
Dude,
that?
I don't know.
Enlighten me.
I heard reports that Takakeisho needed to make it another year and then he was gonna get it. Then I heard reports that he was gonna get it after the July tournament. Then I heard reports that now it's back to a year. I have no idea what's happening, and that's where I think I get frustrated. Why I'm throwing this back to the JSA is like this elder stock system again. They're trying to an extent, and they're trying to put systems in place to prevent abuse and things like that. But guys, he's doing this to himself because he wants the elder stock, and we all know he deserves the elder stock. I was just on
Hmm.
the Sunday Morning Sumo show for the end of the last spa show and talking to those guys, and Goose called me out, but JJ defended me on this idea where I was like, well, no, I'm kind of glad in some sense that Takakeisho didn't get Yokozuna because now he's the greatest Ozeki of all time, was like my opinion, like, but so I'm like, he the greatest Ozeki of all time, and you guys are just jerking him around and making him destroy himself.
Yeah, I'm with you. It's a hard thing to watch, and um it's frustrating. It has to be frustrating for him on a personal level to not really know his future, or how he's going to be taken care of when his career ends, because all careers inevitably end,
Yes.
and so what's the situation
Larry,
to
case in point, Tamawashi, his career will never end. Boomer.
I've told you off air, like I would love to know what is going on in that man's neck and spine. I don't know how he's done this for so many years. It is truly
Is
incredible.
I'm with you. Is he soaking his neck in yak's milk? What is happening?
That I don't know. Um, it, yeah, it's I. But yeah, with coming back to Taco K show, I was trying to like follow along with like what is going to happen with his stock, and it's yeah, that's hard for him to kind of be drug around like that. So then it's like he's kind of got to keep fighting and doing this, and goodness. So
And it's just insane, yeah. And so I guess I don't know. I mean, we'll try to wrap. I don't mean to be negative, but it's tough to be positive in this specific situation. Um,
mhm.
but like, so I think my personal opinion. You are more than welcome to give your opinion, but you do not have to. But I'm just like, I hope he doesn't come back and fight this tournament, because I just feel like every time he does it, he's taking his own life into his hands. I was really proud of a guy like Ishiura who stepped away. Now he's got a background where he didn't originally he wasn't a lifelong sumo guy, even though he had the pedigree, and he never. I mean, he came to the sport and then was great, like everyone knew he would, but didn't necessarily want to when he was younger. Um, but Takakeisho did always want this. And so, like, that's impossible. So I don't want him to fight anymore. I want him to retire because I want to see this guy, if it's in a different capacity, I want to see him involved in the sport for the rest of his life. And I want that to be as long as possible. But after what we talked about, I think he is going to fight. And I think the JSA has to be culpable for that. And they are creating, no individual is doing this to him, but this is an institution that has now organized itself in such a way that it is encouraging a young man to destroy himself.
I just hope he can find, something that is meaningful, in all of this. I hope he can find meaningful work, that doesn't involve him being in the dojo every day. And um yeah, I as far as whether or not I want him to be in the next tournament, um if he's able to, rehab this really well for the next month or so and get to a good place, by all means give it a shot. But um, like I said, I think exhaustive. I think the conservative measures have been exhausted at this point, and so I think he should rest. But that's just me.
Yeah. No, I appreciate you saying that and bringing that up again, because that's like, yeah, in July, I think we saw what the conservative measures get us, what medication, what injections, what physical therapy. I think we saw how far that's taking him now.
Yeah, that's again, it's speculation,
Yeah.
but that's my thought.
Yeah.
So
The cupping. We all know we see the cups.
yeah,
Um,
cupping.
I just, so like on a positive note, then like if we see him, I mean, I'm gonna be in there rooting for a Tochinoshin-esque comeback story when he bounced back up to Ozeki.
Yeah.
It'll be a great story to root for. I hope it's good, and even if it doesn't work out, I don't think anything that happens now can sour his career as it was.
No. Oh, I agree with you. I think that what he did was pretty stellar, and I would love that same thing. I would love for a big comeback for him, just because that is exciting. It's like you said, even if you're not a fan of any of these individual
Yeah.
guys, the sport does better when everyone is firing on all cylinders, and I hope that happens, but I have my doubts.
Exactly,
So.
but we're rooting for the best for him inside and out of sumo, and we are hoping that maybe he can continue to be one of these new generation of voices for change within the JSA as a result of his personal lived experiences.
That would be really cool, I think, actually.
I think so too, and you know what, like, while we haven't seen that yet, there's nothing to say that that's not going to happen. So still plenty of positive things to root for. And here's hoping that we have a healthy Takakeisho fighting in September.
All right.
Larry?
Well, I hope so too.
Yeah. Thanks for joining us. And everybody, thanks for listening. We'll talk to you again soon.